Hi, this is Andrea Kane. I'm here with HSC 114 Medical Terminology at Northeast Iowa Community College. We are now entering week 5, and we are still studying the Language of Medicine, 12th edition by Davie Ellen Shabner. In this week, we will be covering chapters 8 and chapters 9, so you will have 2 videos to watch. This is the first one on chapter 8, which is on the female reproductive system. And as in our previous weeks, our goals are the same. I'm not sure why they didn't include those in our PowerPoint, but they are the same. And we are going to go ahead and get started with the topic of sexual reproduction, which is the union of the nuclei of the ovum and the sperm cell. Those are called gametes. And each gamete contains half the number of chromosomes of a normal body cell. These gametes are produced in the gonads, and the female gonads are the arteries, the male gonads are the testes. Fertilization occurs when the sperm cell unites with the ovum. So the ovum is going to leave the ovaries, travel through the fallopian tube, and at some point there, one sperm cell is going to unite with the ovum. Only one. And then this becomes a fertilized egg. It implants, hopefully in the uterus, and then divides to form a ball of cells called a zygote. Other terms are later known as embryo and fetus. So what are the organs of the female reproductive system? Ovaries, fallopian tubes, uterus, cul-de-sac, vagina, Bartholin glands, clitoris, perineum. And here's a visual for you. So you can see from the side, this is a lateral. So I hate to say it, but if you took a person and you divided them in half, left to right, we are looking at one of those halves. The right half, if you want to be specific. And this lets you see sort of how everything is laid out front to back. The fertilized egg implants, then divides to form a ball of cells called a what? Oh, this one we just went over. So if we talk about the anterior view, some of the things we're going to talk about, the terms that we need to know about are ovary, utero-ovarian ligament, ovarian follicles, ovum, corpus luteum, fallopian tube, fimbriae, uterus, endometrium, myometrium, uterine serosa, cervix, and vagina. And this is an anterior view. This is looking front to back. And this gives you an idea of that. And it gives you a little more detail of, for instance, what is in the ovary. Okay, so the breast is also considered part of the female reproductive system. Men do have breasts, and we'll probably talk about that very briefly with the male reproductive system as well. But here in the female side, it includes, if we look at a sagittal view, think back to week 2, what's a sagittal view? Week 1, sagittal view. Glandular tissue, fatty tissue, ducts, and sinuses. So let's look at that. Sagittal is another name for lateral. Hopefully you were remembering that. And this view gives us a chance to see the female breast from this side. Now we're going to talk about menstruation. In days 1 through 5, you have the actual, what's called the period itself. Blood cells, endometrial cells, glandular secretions discharge from the body. Days 6 through 12 are where your estrogen boosts up. It aids the repair of the endometrium, and the ovum grows in the follicle. Days 13 and 14 are what are called ovulation. The egg leaves the ovary, passes through the fallopian tube, and is looking for companionship, shall we say. Days 15 through 28 are after ovulation, where the corpus luteum secretes progesterone. Notice at the beginning, days 6 through 12, it was estrogen that was spiking. Now, days 15 through 28, it's the progesterone that's spiking. The uterus lining builds up, and then you repeat the cycle. And this is kind of a helpful visual where you could see on the top is the ovary, what happens during that month, those days. And then in the bottom, what's happening with the uterus. So if fertilization occurs and the egg implants in the uterine endometrium, that is good. Unfortunately, sometimes it doesn't implant in the uterine endometrium. It stays in the fallopian tube. And that's where you have what's called an ectopic pregnancy. And that is absolutely untenable for the mom and the baby. There's no way it can grow there. There's no nutrients for it there. And it's an incredibly difficult situation. So moving on, if they implant in the uterine endometrium, which is perfectly normal and is supposed to happen every single time, the placenta will form. It'll attach to the uterine wall. The amnion, that amniotic sac that holds will hold the fetus in the amniotic cavity. So you've got that sac with the fluid in it that's holding the baby. Nutrients, oxygen, waste exchange between the fetus and the mother, and that's how the baby's fed. And then the placenta produces HCG, and this is how pregnancy tests work. They measure the level of HCG because from the very beginning of that placenta being formed, HCG levels start spiking up high, and that's the pregnancy test actually measures that HCG hormone, the level of that, to identify whether or not there's a pregnancy there. So this is a visual of how implantation is supposed to work, that you have the ovary releasing the egg into the fallopian tube. At some point it is fertilized and continues its process down to the endometrium, where it implants and starts to grow. And this is a visual of how the placenta is and all those blood vessels that develop, and how they come together through the umbilical cord into the baby. And then you can see the baby surrounded by the amniotic fluid in the amniotic cavity, and how that all works. So the corpus luteum secretes this monthly to build up the lining of the uterus. Build up the lining. So that should be a fairly easy one to figure out. What does the placenta secrete during pregnancy? We just talked about this. This is how a pregnancy test is made to measure this hormone. So during the pregnancy, progesterone maintains placenta development. This is why some women with very high-risk pregnancies that maybe they've lost previous babies through miscarriage or what's called a spontaneous abortion, that's why they supplement them with progesterone, either tablets or injections, is to maintain that placenta development. But most women are fine, and their normal level of progesterone spikes enough to maintain that development. But every now and again, there is some need for supplementation, and there are tablets and injections that can do that. The uterus expands as the fetus grows. The normal delivery position of the baby is cephalic, head first. There are 3 phases to labor. And I like to kind of joke that if you've ever been through labor, it sure doesn't feel this way. The 3 phases can kind of feel like worser, and worse. But really, the 3 phases from a medical terminology type perspective are dilation and thinning of the cervix, the birth of the infant, and delivery of the placenta. So this is a visual of the baby being born, cephalic presentation, and then the delivery of the placenta afterwards. The placenta detaches and comes out and needs to come out. So how is the pituitary gland involved in all of this? Well, guess what? There are some hormones that happen at this time. The pituitary secretes what's called FSH, follicle stimulating hormone, and luteinizing hormone. And then the pituitary stops producing those during pregnancy and with oral contraceptives. So if you are pregnant or on oral contraceptives, i.e. birth control pills, that type of thing, there is a hormonal shift to where your pituitary gland knows not to secrete FSH and LH. But otherwise, if you're not on oral contraceptives or you're not pregnant or you're not pregnant, your body will just do this. Your pituitary gland knows to secrete those hormones. So what is menopause? Menopause is the gradual ending of the menstrual cycle. It normally begins between ages 45 and 55 with falling estrogen levels. So we talked about how estrogen is there prior to ovulation, that is spikes prior to ovulation. And so you don't have that same activity happening because your estrogen levels fall. There is an option for estrogen replacement therapy. However, what they have found over the years is that estrogen replacement therapy can also cause breast cancer. And it has a very high risk for that, particularly in women who have a family history of breast cancer. So one of the struggles that women face going through menopause is that decision. Do I do estrogen replacement therapy, or are the risks too high and I'd rather not do it? It takes a lot of research and discussion and consultation with a physician and all those types of things to really come out of it with a confidence. So what are vocabulary words that we're going to run across in this section? Adnexa uteri, amnion, areola, Bartholin glands, cervix, chorion, clitoris, coitus, corpus luteum, cul-de-sac, embryo, endometrium, estrogen, fallopian tube, fertilization, fetus, fimbriae, and singular's fimbria, so fimbria, fimbriae, follicle stimulating hormone, that FSH, gamete, genitalia, gestation, gonad, gynecology, human chorionic gonadotrophin, HCG, hymen, labia, lactiferous ducts, luteinizing hormone, mammary papilla, menarche, menopause, menstruation, myometrium, neonatology, obstetrics, orifice, ovarian follicle, ovary, ovulation, ovum, and ova. Notice the difference there. Parturition, perineum, pituitary gland, placenta, pregnancy, progesterone, puberty, perimetrium, also known as uterine serosa, uterus, vagina, vulva, zygote. Which term refers to the inner mucous membrane lining of the uterus? Some combining forms. If you remember our equation, it's a root plus a combining vowel equals a combining form. Amnio, Bartholino, cervico, chorio, coronio, or chorion, colpo, culdo, apesio, galacto, gyneco, hystero, lacto, mammo, masto, meno, metro, myo, myomo, nati, ooh, notice that, N-A-T-I, obstetro, O, with or without the second O is egg. Notice OV is also egg, and so is OVUL. So you've got 3 different ones here for egg, so just be aware of that. Ufero is ovary, and so is ovario, or ovario. Perineo, foro, salpingo, utero, vagino, vulvo. Now we have some suffixes. Arc, Sciasis, gravida, Paris, Rhea, salpinx, toscia, version. Prefixes, dis, endo, in, intra, multi, nulli, pre, primi, retro. Which term means removal of the breast? Removal of the breast. This means to remove the whole breast. Excise it. All right, what can go wrong with the female reproductive system? Well, unfortunately, there's quite a few things. There's cervical cancer, cervicitis, endometrial cancer, endometriosis, fibroids. These are benign tumors of the uterus, fibroids. There's ovarian cancer, ovarian cysts, pelvic inflammatory disease, breast cancer, and fibrocystic breast disease. This is an example of a mammogram on the left showing an abnormality. And that abnormality is invasive carcinoma of the breast. And the next slide is an example of invasive ductal carcinoma after it's been removed. What can go wrong with pregnancy? Well, you can have abruptio placentae, where the placenta pulls away from the uterus and starts hemorrhaging in the mother. The blood just starts hemorrhaging. Choriocarcinoma, ectopic pregnancy, we talked about that, where the implantation of the egg occurs in the fallopian tube and not in the uterus. Placenta previa. Placenta previa is where the placenta decides it's going to settle and grow over the cervix. And so when it comes time for the baby to be born, there's all sorts of trouble that go on with it. Preeclampsia, that is extremely high blood pressure during pregnancy. In terms of the baby themselves, they can be challenged with Down syndrome or other chromosomal disorders that happen during the baby's development, early development. Hemolytic disease, hyaline membrane disease, hydrocephalus. At birth, meconium aspiration syndrome can be an issue if a baby is over 40 weeks. Pyloric stenosis. You may have heard of APGARs. They score babies' APGARs at birth and then at 1 minute after birth and 5 minutes after birth. And so this gives you an idea of the chart. So these are the signs that they're looking for. They're looking for heart rate over 100, respiratory effort good and crying, muscle tone active motion, response to catheter or nostril after the oral pharynx is clear being a cough or sneeze, the color being completely pink. If they don't see that right at birth and at 5 minutes after birth, then they'll check it again at 10 minutes after birth. But usually APGAR scores should be at least 7, 8, 9 right there at birth. Otherwise, there's going to need to be some interventions involved. Clinical tests and procedures that are done on the female reproductive system. Pap smear test, pregnancy test. There are plenty of other procedures such as mammograms, breast ultrasounds, pelvic ultrasounds, hysterosalpingography. Conization. This is done to remove a cone-shaped section of the cervix. Oftentimes it's done because of abnormal cervical cells that they're afraid might be cancerous or precancerous. Laparoscopic oophorectomy, removal of an ovary. This shows how it's done through a laparoscope. During pregnancy, they may choose to do an amniocentesis to test the fluid around the baby. They can tell quite a few things from that. Abbreviations. There are quite a few abbreviations here in this section. So I'm just going to skip through here, but make sure that you're familiar with those. If you have seen OB charting, you see para, and then you see the numbers, the 4 numbers that come after that. That is a woman's reproductive history. It's how many full-term infants has she had, how many preterm, how many abortions or miscarriages, and how many living children. That's what those 4 numbers mean. And here are the rest. Okay, combining forms. Remember our equation. It is a root plus a combining vowel will equal a combining form. Amnio, Bartholino, cephalo, cervico, chorio, choriano, colpo, coldo, apesio, galacto, gyneco, hystero, lacto, mammo, masto, meno, metro, myo, myomo, nati with that I, obstetro, oligo, O. The letter O means egg. But remember, so does ovo and ovulo. And then you have 2 here for ovary, oofero and ovario. Perineo, foro, pio, salpingo, utero, vagino, vulvo. And then those suffixes, arc, seal, ciesis, ectasis, ectomy, flexion, genesis, gravida, itis, perunia. Hang on. Perunia. Okay. Paris. Plasia, plastytosis, ragia, Raphy. Raphy is a new one for us. Watch out for that R-H-A-P-H-Y. Raphy. Rhea, salpinx, scopi, stenosis, stomy. Tosha, tomi, tresia, version. Now on to prefixes. Bi, dis, endo, in, intra, multi, nulli, oxy, peri, pre, primi, pseudo, retro, uni. And that is it for Chapter 8, the female reproductive system. I'll be back shortly with Chapter 9, which is the male reproductive system, and that will finish us off for Chapter 5. Take care.